this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this week's video. On this week's video, we're taking a break from our ongoing series, the QME Top 10, and today I want to bring you some information about something that's brand new, something that has potential immediate impact on the work that we do as qualified medical evaluators. And that is on February 19, 2016, just a couple of weeks ago actually, as this is being recorded, a new bill was introduced into the California legislature. A new bill was introduced that impacts the work that we do as qualified medical evaluators, because it's a bill that affects the medical treatment of California's injured workers. And specifically, this bill relates to spine injury cases. So those of you that are qualified medical evaluators that evaluate spine injury cases, this is going to be of great concern to you. And for those of you that don't evaluate these types of injuries, I think the process involved and the lawmaking process and the process involved with bringing any new idea, any concept into legal fruition is illustrated here with this principle. So I want to share it with you, and I believe that you'll be interested in this from several different perspectives. So this is Assembly Bill number 2407, and this was introduced by Assembly Member Rocky Chavez. Now I want you to know that just yesterday, the day before today, the day before this video is being recorded, I was at a legislative conference in downtown Sacramento. I was attending some meetings with the California Chiropractic Association, and we went to the Capitol in the afternoon and we lobbied several senators, assembly members, congresspersons, and other lawmakers whose support is important for the passage of this bill. And so I got a good look at the inner workings of some of these behind the scenes administrative hoops, hurdles, and loopholes that have to be surmounted in order to have a bill actually come to fruition and actually come through these stages of its evolution. It's quite interesting, and I'll share that with you. But I want you to know that this is not a chiropractic story. This is a story that affects all of us as qualified medical evaluators. It just happened to be that it was being lobbied and supported by the chiropractors, and I happen to have been invited to that event, and that's how I'm privy to this inside knowledge that I want to share with you today. So we also listened to several assembly persons, senators, and other politicians speak on behalf of this bill. So I want to share with you today what I learned about this bill and how I believe that it will ultimately, if it's passed in its exact language, how it will ultimately affect us as qualified medical evaluators. And I just want to give you a hint and a heads up to the bottom line when we get there in just a few minutes. It's my opinion that this bill is probably a decade away from ever coming to true fruition through the passage of all the appropriate regulations and administrative language that would be required. And if it does pass and if it does come to fruition, it's my opinion that it'll probably be changed 10 times, because as it's written right now, it seems to me to not be an efficacious bill, and I'll share with you my reasonings for that. And I stipulate by saying that these are simply my reasons and my opinions alone, but I do want to share those with you because I have given it some time, some thought, and some attention. So this is Assembly Bill 2407. And Assembly Bill 2407 adds a new paragraph, paragraph 7, to Section D of Labor Code 4600. Now, Labor Code 4600 directly relates to the work that we do as qualified medical evaluators, because 4600 talks about the delivery of medical care to California's injured workers. So I've given you a link in today's blog for Labor Code 4600, so you can review that at your own leisure. And I want to read for you word for word the new language of new paragraph 7 that would go into section D of Labor Code 4600. And this relates to spine injury cases, and this paragraph is taken from the new Assembly Bill 2407, exactly as it's written. Okay? So this is the new paragraph. It says, if the employee's injury affects his or her back, so we're talking about spine injury cases, the same philosophy could apply to other orthopedic injuries as well, but this bill is specifically written to address spine injury cases. It says the physician or other medical provider shall assess the employee's level of risk for chronic back pain. Now, we do have those examinees, those injured workers that go on to develop chronic back pain, don't we? So this is talking about them. This is talking exactly about that population of injured worker. The medical provider shall assess the employee's level of risk for chronic back pain and determine whether he or she meets the criteria for a surgical consultation. After the assessment, one or more of the following covered treatments may be deemed appropriate: acupuncture, chiropractic manipulation, cognitive behavioral therapy, medications including short-term opiate drugs but excluding long-term prescriptions, office visits. Doesn't say office visits to what, but it says office visits, osteopathic manipulation, and physical and occupational therapy. Surgery may be recommended, but only for a limited number of conditions and only if there is sufficient evidence to indicate that surgery is more effective than other treatment options. Yoga, intensive rehabilitation, massage, or supervised exercise therapy may also be recommended for inclusion in the comprehensive treatment plan. Now, that's a lot of language, and I know if you're like me, as you're listening to that language, you come up probably with 100 different questions as to how could this possibly be implemented, and who is going to be responsible for the different stages of the implementation of this bill. But let's not go into that just yet. Let's just say that on the surface, the purpose of this bill is to hopefully reduce the unnecessary spinal surgeries that are taking place, and hopefully to reduce the number of patients who are becoming addicted to the long-term use of opiate medications. So on the surface, this bill proposes the use of conservative care treatments prior to an examinee accepting or undergoing a surgical correction for their spinal condition. So on the surface, it would seem that this bill has an altruistic motive. It hopes to serve examinees and prevent examinees from going through what otherwise could be an unnecessary spinal surgery. It hopes to prevent examinees from becoming addicted and dependent on long-term opioid use. It proposes to save probably millions and millions of dollars of cost on unnecessary surgeries that could be for conditions that could otherwise be resolved through conservative measures. And on the surface, the language, in my opinion, the language of this bill is altruistic and is good, and it serves a high motive. But it's my opinion that this bill probably is going to be found to be not efficacious. It's probably going to be found to be not cost effective. It's probably going to be found that the language in this bill applies to such a small subset of spine injury cases that the cost savings of those unnecessary surgeries in the small subset of cases is more than offset by the costs of these conservative care treatments and the added costs of the additional total temporary disability time while the examinee undergoes these conservative treatments. And before I get into a flow sheet and a flow chart as to how this bill would fit into what we consider to be the current treatment flow of an examinee through workers' compensation treatment, before we do that, I just want to talk about a couple more points about this bill. Okay? A couple more points about this bill. Now, it's important that you know that in January of 2016, just 1 to 2 months ago, the Oregon Health Plan, which administers the state's run health insurance plan, approved changes to treatment reimbursements for spine injury cases. And this bill, Senate Assembly Bill 2407, is mirrored and fashioned exactly after the same bill that recently passed in Oregon. So let me give you a couple facts about that. In January 2016, the Health Evidence Review Commission of Oregon, which oversees the Oregon Health Plan, has approved changes to coverage for treatments for back conditions in response to opioid and surgery overprescribing, and the reimbursement for treatments include all the conservative care components of Assembly Bill 2407. So with Assembly Bill 2407, we said that that included acupuncture, chiropractic manipulation, cognitive behavioral therapy, medications, office visits, osteopathic manipulation, and physical and occupational therapy, yoga, intensive rehabilitation, massage, or supervised exercise therapy. So the language in Assembly Bill 2407 was fashioned after the same bill that passed recently in Oregon. Okay? And in Oregon, this Health Evidence Review Commission is composed of 5 medical doctors, 1 doctor of osteopathy, 1 doctor of naturopathy, 1 doctor of psychology, 1 doctor of dentistry, a pharmacist, a registered nurse, and other health advisory officials. So this group felt it to be appropriate in their wisdom to require back injury cases at risk for surgery. They're requiring them to go first through a conservative care treatment approach, including all of the modalities that we talked about, prior to submitting to or accepting a surgical correction for the spine. So after much review in Oregon, they felt it to be efficacious and a cost-saving measure to require conservative care treatment be exhausted before submitting to surgery, because some of those surgical cases could be resolved through conservative treatments. So the bill in California, Assembly Bill 2407, is fashioned and mirrors a similar bill in Oregon. Okay, so it wasn't just made up out of thin air. It began in Oregon. Okay. Couple other facts. An independent study by the California Workers' Compensation Institute found that California has seen a 300% increase in opioid prescriptions over the last decade. 300% increase in opioid prescriptions in the last decade in California's workers' compensation system. Injured workers are taking more and more opiate medications and becoming dependent and addicted on those medications. Okay, so let's review, and then let's dissect this bill with a fine-tooth comb and see how this bill and the treatment modalities and measures that it proposes would fit into the typical flow of treatment for a California injured worker. So the highlight points are that for spine injury cases, this bill requires that examinees be evaluated to determine if a conservative care approach could be effective for them and could be a solution for them so that surgery could be avoided. Now, the bill doesn't say who would do the assessment, and that's, of course, a major issue that has to be handled. The bill doesn't address the fact that injured workers already have access to conservative care, such as chiropractic, such as acupuncture, such as physical therapy, etc. It doesn't address those things, so there's many unaddressed components of this bill. However, on the surface, it's my opinion that the language serves the greater good, is altruistic, and has good intentions. But it's my opinion that it's going to prove to be not efficacious, and I want to share with you some of the reasons for that. So in order to do that, we're going to go to the whiteboard and go through a flow chart or a flow sheet of the treatment protocol of a typical worker in the California workers' compensation system. So we'll take a break right now. I'll get out the whiteboard, and I look forward to being back with you in just a couple minutes as we review today's topic, which is the new and pending bill, which could impact us all here in the near future as qualified medical evaluators, and that is Assembly Bill 2407. Okay, I'm back with you now, and what I want to do is I want to take you through a flow chart that describes the typical treatment that is available now in the workers' compensation system. I want to talk about some proposed implementation of the new Senate Bill 2407 with its conservative care treatment approach, and I want to integrate that into the treatment protocol. And then I want to bring the bottom line close to home and let you know that based upon my assessment of the flow of the typical treatment of a workers' compensation injured worker, it's my opinion that 2407 is going to prove to be not efficacious, not cost effective, and really isolates and talks about a small subset of the spine injury cases. In fact, it's such a small subset that the potential cost savings in unnecessary surgeries saved, the number of unnecessary surgeries saved, is going to wash out against the added costs of, number one, the conservative care approach that we're proposing with Senate Bill 2407, and then also the additional TTD, total temporary disability time, that hundreds and hundreds of injured workers would be garnering and gathering while they go through the proposed conservative treatment approach. For these reasons, it's my opinion that's going to prove to be not efficacious. So I hope you can see this and try and stay as much out of the way as possible. But let's talk about the flow of a typical claimant through the workers' compensation treatment system. Here we're talking about spine injury cases. And just stay with me. Try not to let your eyes wander because there's a lot of detail here and we will go over the detail. But we're talking about spine injury cases. Now, of the spine injury cases, we're going to see some cases that are emergent. Let's say a guy fell off the roof of a building, fell flat onto his spine, suffered multiple fractures, he's neurologically unstable, and that's an emergent case. Those cases are going to immediately go to surgery when necessary. So for the emergent cases, those that are neurologically unstable. Senate Bill 2407 does not save or address those people. Some people need to have emergent surgery. So this group of people is immediately out of the discussion, okay? Now, for other spine injury cases, we have to consider what are the typical diagnoses that we're talking about here. We're talking about sprains and strains, disc injuries, prolapses, facet syndromes, sacroiliac syndromes. The list of potential diagnoses that enter the treatment protocol is limited, it's finite. But for those cases, they're going to go through here what I consider to be the treatment cycle. And the treatment cycle could include medical doctor treatment, chiropractic treatment, physical therapy treatment, acupuncture treatment. All of these treatment modalities are currently available to injured workers in our system. Many people enter the system with a doctor of chiropractic as their primary care physician. Others enter with a medical doctor as their primary care physician. Others enter with a doctor of osteopathy as their primary care physician. So California injured workers already have access to chiropractic, and Senate Bill 2407 does not address that. It assumes that injured workers do not have access to chiropractors, when in fact they actually do. So imagine this. A spine injury case enters the treatment cycle here, and out of the bottom of the treatment cycle, we're going to see a couple of different outcomes. Now, the treatment cycle here offers the injured worker many opportunities. It gives them the healing tincture of time to go through treatment. It gives them the healing benefit of the treatment itself. And we know that physical therapy treatment is good. We know that chiropractic treatment is good. We know that acupuncture treatment is good and it heals people. We know that medical treatment heals people. It's good. All of these treatment modalities, and if you spoke to any one of these treatment providers, they will tell you that when they treat people, people get well. If you ask me, I'm a chiropractor. If you ask me, when a back injury case comes into me, I'll tell you, I get them well. My treatments help people, okay? So it gives the examinee the healing benefit of the treatment. It also gives them the benefit of the natural history of their condition. And many conditions, as you know, have a natural history. They get well all on their own with no treatment whatsoever. So during the treatment cycle, there are many benefits, many healing benefits being bestowed upon these cases. But regardless, out of the bottom of the funnel comes cases that are either resolved or unresolved. Okay? There's our two categories of cases. We're going to have those people who say, okay, I went through treatment, I'm better, I'm good, I'm discharged, I'm well. Now let me ask you, what type of injured worker do you think it would be that is most likely going to achieve a resolution of their condition? What type of person, what kind of characteristics is this person going to have? Well, the one thing that we can say about this type of person is that they're probably motivated. They're probably motivated to get well. They want to get well. They want to resume their normal lifestyle. They want to get back to work. Then we're going to have those cases that are unresolved. Now, of the unresolved cases, we're going to see two types of examinees. We're going to see those that are sincere examinees. They're motivated and they sincerely want to get well. But the treatment approach, for whatever reason, did not provide them a lasting resolution of their condition. They're sincere, but they just didn't respond to this treatment. On the other hand, we're going to see those examinees who what I would call insincere. And I hope you can see that. These are people who, for whatever reason, are not motivated to get well. And we'll talk a little bit more about them here in just a couple minutes. But let's talk about the sincere examinee who wants to get well, but the treatment approach, whatever it was, didn't provide them a lasting resolution. These sincere people, now we're going to send them through this conservative treatment approach. Whatever they didn't get here, whether it be the yoga, the cognitive behavioral therapy, the supervised exercise rehabilitation, all of those conservative care measures that are proposed in Senate Bill 2407, we're going to provide them right here. This is the conservative treatment approach. Again, we're going to have those examinees coming out of this treatment that are resolved. And in this sense, we can say that here, this was a big win. Here, the conservative treatment approach worked, it saved money, it resulted in a resolution of the case, and it was beneficial. On the other hand, for those examinees that come out of the treatment approach unresolved, these people now, having failed the conservative treatment approach, they're going to get a surgical recommendation. And by the time they get here, we know that indeed they're a true surgical candidate. They failed conservative treatment approaches. So the only treatment left for them is a surgical approach. Of this group, some will accept the surgical recommendation. Their case, their condition, would then be resolved. In this case, the conservative treatment approach did not help. They required a surgical correction. It was necessary. It was inevitable. They had it. They're done. And there will be a small group of people who decline a surgical correction and who will go on to probably have chronic pain and probably require long-term use of medications. Okay, so for the sincere examinee, there is a group of people where this conservative treatment approach will help. It will resolve their condition, and in this case we can say that there was a big win. There was a big win, and it was worth it. It was worth passing the assembly bill. It was worth having this language in the law. It was worth providing them different treatment options. It helped, and it's a win. So we mark these as a win. Okay? Now on the other hand, and I hope you can see this, we have those unresolved cases that involved an insincere examinee. Now this may come as a shock to many of you, and to others you'll simply nod your head when I tell you that there are groups of examinees and injured workers in the system that are not sincere, that have no intention, no intention of getting well, or no intention of admitting that indeed they're well. They're not motivated to get well. Those are the insincere examinees. Well, let's say, for example, that we take the insincere examinees and we put them through the conservative treatment approach. Whatever they didn't get here. If they had chiropractic here but they failed chiropractic, we then provide them with physical therapy, acupuncture, cognitive behavioral therapy, exercise therapy, intensive rehabilitation, all the language that's described in Senate Bill 2407, we give it to them here. They will come out of this treatment program either resolved or unresolved. Now it's my opinion that because these examinees here are not motivated, that the group that comes out of this resolved is going to be few, and the ones that come out of it unresolved is going to be many. Many. In this case, the conservative treatment approach worked, but for just a few number of people, so we'll give that a win. We'll give that a little win here, little win, We didn't consider them to be totally sincere, but for whatever reason they admit that they're better. It's my opinion that that will be a few number of people, but we'll consider that a win for the conservative treatment approach. The greater majority are going to be those who are unresolved. They're unresolved because no matter what you do, they're not getting well. And I have 3 of those cases on my desk right now where the treatment has gone on for years and years and years, and it's included every possible modality, including injections. I should put injections up here. And they're not getting well. They're defying natural history. They're not healing over time. Whatever treatment we're giving them is not working. What type of person does this represent? Well, it represents someone, in my opinion, who is insincere. They're not going to get well. These are the unresolved cases. These are many. In this case, the conservative treatment and the cost of the conservative treatment was a waste. It's wasted because they're not going to get well. No matter what you do, no matter how much money you spend, they're not going to get well. In addition, the time of total temporary disability here, as they undergo the conservative treatment, was also wasted. Or I would say was increased or accumulated right here. Right here is tremendously expensive in the form of increased TTD and the cost of treatment. And I hope you can see that. Okay? Tremendously expensive. Well, these insincere examinees are going to come out of the conservative treatment protocol unresolved. They're going to get a surgical recommendation. What are they going to do? Are they going to accept the surgical recommendation? No. They're not going to accept the surgical recommendation, and they never do. In fact, they always decline invasive treatments because they know that their condition is not as bad as they purport it to be. They know that they don't need surgery. So they decline, they don't accept, they decline a surgical recommendation, and what they do is they settle their case by compromise and release and capture the value of the surgical recommendation in their settlement amount. In other words, if they're recommended to have a $35,000 surgical procedure, they capture that value in their future medical award, and they compromise and release the case and settle it out for some fraction of that, the value of that surgical correction. And in that sense, they capture the value of the surgical recommendation. And Assembly Bill 2407 does not prevent this from occurring. For many examinees, this here is the goal, is to get a written recommendation for surgery that they can then later compromise and release out. So if this is the goal, why spend money on the conservative treatment? Why put them through any treatment protocol at all if they're not going to get well? And Senate Bill 2407, with its conservative treatment recommendation, does not address that. And so in my opinion, for these reasons, it's my opinion that Senate Bill 2407 is just not efficacious and won't offset the cost of the unnecessary surgery saved with the added cost of the conservative treatment and the additional total temporary disability time. Because let's face it, many examinees would love to have 6 months of supervised exercise therapy sessions while they're home on TTD. They'll take that recommendation all day long, followed by yoga, followed by acupuncture, followed by chiropractic and all these passive modalities. Meanwhile, they're chewing up time on TTD and never intending to get well in the first place. So let's conclude today's discussion with just a couple remarks. And that is, it's my opinion, and this is just a very cursory opinion, been exposed to Senate Assembly Bill 2407 for only 24 hours. But I've heard many speakers speak of it and about it, and spent the entire afternoon yesterday lobbying lawmakers with knowledgeable people from the California Chiropractic Association. So I believe on its surface, the language of Senate Assembly Bill 2407 is altruistic and is for the higher good, and it purports to help California injured workers, and it purports to save costs through the elimination of those surgeries that would otherwise be unnecessary. But it's my opinion that this bill is about a decade from actually being a regulation that impacts us in the day-to-day treatment of injured workers and in the evaluation of those injured workers at the end when we see them as QMEs. So it's a long way off. It has a lot of administrative and administrative and legislative loopholes and hurdles to surmount before it becomes actual active law that affects us in our work. And so I believe for now it's just a concept that's being considered. So for those reasons, it's my opinion that we're going to continue to see the same sequence of events with the exception of the conservative treatment. This is the current sequence that California injured workers go through, and it's my opinion that inserting a conservative treatment protocol in this flow at any point is not going to change the outcome of those examinees who are insincere and have no intentions of getting well. Anyway, for those examinees who are sincere, this could be a valuable bill for them. However, my opinion is that number of those examinees is extremely small, and so this bill just simply addresses too small of a population to make any significant difference. So I hope you found that interesting, some of what's happening on the current political landscape. This is Dr. Perry Carpenter. I want to thank you for being with me on today's video. Look forward to being with you next week's video, where we pick up on our ongoing series, the QME Top 10. And next week we're going to be talking about compensable consequence injuries. So I look forward to being with you then. And for now, I'm wishing you best of success in your career as a qualified medical evaluator.